Welcome to Theme 1. In this video, we will discuss how PrEP works and more specifically, how it works in relation to the HIV virus. Let us begin by discussing what oral PrEP is. Oral refers to the method with which this medicine is administered, which is orally. PrEP stands for pre-exposure prophylaxis. Pre meaning before, exposure referring to exposure to HIV, prophylaxis meaning prevention. Prophylaxis is the provision of medications prior to a germ or virus exposure to prevent infection. PrEP is an oral medication that can be taken by an HIV-negative person to prevent contracting HIV. Oral PrEP is a single fixed-dose combination of two antiretrovirals, namely tenofovir, or TDF, and emtricitabine, otherwise known as FTC. Oral PrEP should be taken daily in order to provide maximum protection from HIV. Oral PrEP is not intended as a lifelong intervention, but rather should be used for periods in one's life when one feels at increased risk of HIV. Current South African guidelines recommend 7 days of daily oral PrEP build-up to reach a maximum drug levels of protection before a potential exposure. The guidelines also recommend continued use for 28 days of PrEP after an exposure in order to be fully protected. We recognize that most people cannot plan for all life's incidents, accidents, and happenings, specifically and accordingly, and therefore we recommend using oral PrEP during periods in one's life when one may be at risk. We call this seasons of risk. For example, a young woman who studies in an urban city but lives outside the city. During the 9 months of the year when she's attending classes and has multiple partners, she may feel at risk. However, at the end of the year when she returns home, she may stop using oral PrEP for those periods she is not at risk. The World Health Organization recommends that oral PrEP containing tenofovir should be offered as an additional prevention choice for people who are at substantial risk for HIV as part of a combination prevention. They define substantial risk as a population group with an incidence of HIV infection of about 3 per 100 person years in the absence of PrEP. This can be based on the epidemiological context or on an individual risk assessment. The combination of tenofovir and emtricitabine has been chosen for oral PrEP because high efficacy was demonstrated in both preclinical and clinical studies, with high concentrations of these found in both the genital tract and blood. Oral PrEP is a safe medication with mild side effects and is very well tolerated. Lastly, it only requires 1 tablet a day, which can be taken with or without food. But more about this later. PrEP is not intended to be used as a standalone intervention, but should rather be used as part of a combination HIV prevention in the context of SRH service delivery. Other examples of HIV prevention that make part of the combination prevention package includes condoms, pre-exposure prophylaxis, counseling, post-exposure prophylaxis, following a healthy lifestyle and getting tested regularly for HIV, screening for and treating sexually transmitted infections, voluntary medical male circumcision, knowing your partner's status, and if your partner is HIV positive, getting them on treatment and virally suppressed. It is important that PrEP is provided as part of a comprehensive package. PrEP may not be the ideal option for everyone, and so marketing it as a be-all and end-all product can be harmful for people who may not choose to use it. Remind people that they have other options to use together with or instead of PrEP if they so choose. It is important to remember that PrEP only protects you from HIV and does not protect you from other STIs or pregnancy. So why is TDF and FTC specifically used for PrEP. High efficacy was demonstrated in both preclinical and clinical studies, with high concentrations of these found in both the genital tract and blood. Studies have also shown that tenofovir and emtricitabine combination has a favorable safety and tolerability profile. It is considered convenient as only one tablet is required to be taken per day and can be taken with or without food. You may be wondering what is the difference between oral PrEP, PEP, and ARTs. Antiretrovirals are used both to treat and prevent HIV, and often the same medications are used for both. This has caused some confusions with regards to what the differences are between PrEP, PEP, and ART. We will now go through what the main differences are between these three. Firstly, oral PrEP, as mentioned previously, is short for pre-exposure prophylaxis. It is the use of ARVs taken by HIV-negative people before an exposure to HIV. It is a tablet that should be taken daily during periods of risk to prevent HIV acquisition and is not intended to be a lifelong medication. South African guidelines recommend using it for at least 7 days before an exposure and 28 days after your last potential exposure in order to be optimally protected. PEP is post-exposure prophylaxis. This is the use of ARVs given to HIV-negative individuals after an exposure to HIV. For example, a burst condom, after sexual assault, or after needle stick injury by people who inject drugs or work in the medical profession. This medication is taken after an exposure, but in order to be effective, it must be given within 72 hours after an exposure. It is also taken daily and must be continued for 28 days. It is a combination of 2 or 3 antiretrovirals. Lastly, ART is given as treatment for people who are HIV positive. It is given to HIV positive individuals in order to minimize the effects of HIV, strengthen their immune system, reduce their viral load, and increase their CD4 count. It is used daily and is intended as lifelong treatment. In South Africa, we use a combination of 3 antiretrovirals to treat HIV. It is important to be able to distinguish between these 3, as all 3 use antiretrovirals, but their purposes are very different. We will now dive a little deeper into how oral PrEP works to prevent HIV. As we have mentioned previously, oral PrEP is a combination of 2 antiretrovirals, tenofovir and emtricitabine. So in short, when HIV enters a healthy T cell, it attempts to make copies of itself using an enzyme called reverse transcriptase. The NRTIs, tenofovir and emtricitabine, block this enzyme, preventing HIV from making copies of itself. By getting high levels of oral PrEP in the bloodstream, rectum, and vaginal tissues, you can prevent HIV from entering, replicating itself in the T cells. Let's have a look at how reverse transcriptase works in action. The HIV virus attaches to the surface of the CD4 cell. HIV proteins and enzymes are released into the cell. Reverse transcription produces a double-strand HI virus. Integrase enables HIV to link into the cell's DNA. Protease cuts and reassembles the new HIV. Each cell produces hundreds of new virions. Oral PrEP blocks steps 1 to 3, preventing the HI virus from attaching to the surface of the CD4 cells and the subsequent production of the double-strand HI virus. Okay, that's it for theme 1. Grab a pen and paper and let's summarize what we have just discussed. PrEP stands for pre-exposure prophylaxis. It is used to protect an HIV-negative person from acquiring HIV. Oral PrEP is a combination of 2 antiretrovirals in a single tablet fixed-dose combination. It is a daily tablet used for as long as you feel that you are at risk, and should be provided within the context of a combination HIV prevention package and SRH services. It does not protect against pregnancy and STIs. We have come to the end of the video for Theme 1. Answer the questions below and then move on to Theme 2. Remember, you can come back to this video at any time and watch it as many times as you need to.